First, the CDC's Independent Advisory Committee is recommending COVID-19 booster shots for children between 5 and 11 years old. The decision could pave the way for tens of millions of parents to get their kids boosted as cases and hospitalizations rise once again. Federal health officials say more than a third of Americans are living in communities where infections are at medium or high risk levels. New cases are now topping 100,000 per day ahead of Memorial Day weekend. Deaths and hospitalizations are also climbing across the nation. Nikki Battiste leads off our coverage from Connecticut. Nikki?
Those Pfizer booster shots could be available at this pharmacy and others across the country as soon as tomorrow. There is an urgency for parents here in Connecticut. COVID cases have jumped more than 100% in just a month.
COVID concern skyrocketing. Nationwide, hospitalizations are on the rise in 40 states. Cases are up in 41 states.
The reality is much worse because we're undercounting COVID cases. Many people are testing at home, using at-home rapid tests, and many people are not testing at all.
There's also deepening concern among parents. The American Academy of Pediatrics reports that cases among kids have climbed 76% in the past 2 weeks. Late today, a CDC scientific panel voted to recommend a third dose of the Pfizer vaccine for children ages 5 to 11, even though only 28% in that age group have gotten their first 2 doses.
This current wave of infections among kids could well land a lot of kids in the hospital.
In Connecticut, COVID cases are up nearly 118% in the past month. That's where Bridget Touchard is raising 2 young immunocompromised kids. Both 5-year-old Teddy and 3-year-old Liza have type 1 diabetes.
Vaccine is so important to us because it's basically another tool, another weapon in our arsenal to keep them safe. It's been wildly stressful, the way that I think all parents are dealing with the unknown that is doubled or maybe even tripled for us.
Her son got his 2nd dose last month, just before his 5th birthday.
Do you feel like parents are only thinking about their own child?
I do. The vaccine really does save lives and protect lives.
The CDC panel recommended children ages 5 to 11 get their booster at least 5 months after their 2nd dose. The FDA has said a COVID vaccine for children under 5 could receive emergency use authorization in June. Jamie?
I know a lot of parents waiting for that. Nikki Battiste, thank you so much. Dr. Celine Gounder joins me now. She is the editor-at-large for public health at Kaiser Health News, as well as an infectious disease specialist and epidemiologist at NYU and Bellevue Hospital. Dr. Gounder, thank you so much for joining us. Such important information here, because when you dive into the numbers, less than 30% of children ages 5 to 11 years old have been fully vaccinated. I saw that number today, and I know the messaging has been out there of how important it is and how effective these vaccines are. So for parents who are still hesitant to vaccinate their children, what do you say to them at this point?
My message, Jamie, is that these vaccines are very safe and highly effective. They're highly effective in keeping kids out of the hospital and, in rare cases, in terms of preventing death. We are seeing many more cases among kids now with these far more infectious subvariants of Omicron. Over the winter months, we saw many more kids getting sick with the original Omicron variant and ending up in the hospital. And so this is something that should not be taken lightly.
Yeah, I know there's a lot of virus right now in terms of kids at school are spreading it at this point, but there's also just a lot of spread in a lot of communities overall. And I know a lot of people are asking themselves, especially with the Memorial Day holiday coming up, what can we really be doing to limit the spread of the virus right now? And I know that's somewhat of a silly question because we've been dealing with this for 2 years, but there are those of us who have been masking since the beginning, and now you go to an airport and other people aren't masking. So what should everybody really be doing?
Look, it's the same things we've been saying for the last 2 years, and those things work. I myself flew back home to New York today, and yeah, only maybe a third of folks on the airplane were masked, but I was masked, and I know I was protected by being masked. So masking certainly will protect you if you're in indoor crowded spaces, and the more you can spend time with other people outdoors, where you have essentially perfect infinite ventilation, the safer you're going to be.
That's really an important point. I think I had a couple friends even text me earlier saying, you know what, I'm not eating in restaurants again if it's inside. If we have plans this weekend, let's make sure we're eating outside. And a lot of that conversation's happening because there are early signs that the nation could be entering another COVID wave. Can't believe we're talking about this again. Is the U.S. prepared to tackle yet another spike, especially like the one we witnessed this past winter when Omicron just started ramping up?
The U.S. is frankly in a really tough place. Only about 2/3 of people are vaccinated, and we've really plateaued at that level for months now. In terms of testing, we're not testing enough. We're running out of testing. You have domestic manufacturers that make those rapid tests you use at home that are scaling back and shutting down manufacturing, which will mean we'll have to rely on countries like China for our supply. We don't have enough money to buy a lot more Paxlovid and other therapeutics. And we are, big picture, just running out of money for our COVID response. And so we're in a really tough spot and not prepared.
Is this just a case of everyone's just so over it that they're acting like it's over?
I think, Jamie, that is kind of what we're seeing. I think people are tired. They want to wish this away, but wishful thinking will not make COVID go away. The only thing that will make this go away is really hard work and patience and, frankly, funding. And we do need to put more resources into purchasing more tools, more of those tests, more of those vaccines, more therapeutics, and paying for the people who do the work of diagnosing and treating and administering vaccines. All of that costs money, and we simply don't have the funds to do any of that right now.
I think that's an important point that you're making. I do want to switch gears before we have to let you go because New York City's health department is investigating a possible case of monkeypox. The patient is being cared for at Bellevue Hospital where you work. So, doctor, should we be concerned about this virus? When you hear it initially, it is a little scary. Should I really be scared?
Monkeypox is a relative of smallpox, which was a really deadly virus that was eradicated back in 1980. Monkeypox is milder, but that doesn't mean it is always mild. This is a disease that's manifested by fever, chills, rash. We've seen cases in places like the UK, Nigeria, and now the US. We're still not entirely sure of how widespread this is, but I would say stay tuned. And this is not something to panic about, but just, stay tuned and see what the health department has to say.
Just another one to keep an eye on. Dr. Celine Gounder, thank you so much for joining us. Appreciate it.
My pleasure.